We're running a trial into tracing the spread of COVID-19 because you've been ill for a few days now, I believe.
A man on his phone in his garden with a paper and pen. It's not very high tech and you don't need an app.
You've got your work, right, and that's in a care home, is it?
A care home worker who's tested positive for coronavirus, being asked to remember who they've been in contact with. This is what traditional contact tracing looks like. Its advocates believe a network of local volunteers on the ground is the way to get us out of lockdown.
Rather than it as a virus pandemic, we think of it as lots of little outbreaks of the virus. And as a community, if you can stop your outbreak, and that happens all around the country, actually the whole thing dies back.
Rowan Todd is part of a group of volunteers in Sheffield. They were so concerned when the government stopped contact tracing back in March that they launched their own pilot in collaboration with local GPs.
Good. And have you any other contacts you can think of?
One of the contacts the group has traced is 21-year-old Sam.
I felt quite shocked at first, not knowing 100% what the virus is like at the moment. It was scary.
Despite his initial shock, Sam says it was a relief to talk to a real person with local knowledge who offered support, rather than being contacted via an app.
There's someone there you obviously can talk to on the phone. There's someone there to give you that support and just someone to be there for you.
The WHO recommended contact tracing at the start of this pandemic, but the UK government abandoned the policy as the number of cases and deaths began to rise. There are some public health professionals who believe it's too late for contact tracing because the virus has spread too far. Given the scale of the disease across the UK, they believe that smartphone apps would be a better way of providing automatic contact tracing. This week, the government is piloting a contact tracing app on the Isle of Wight, which it says could be used in conjunction with testing and manual tracing. And why are smartphone apps better than, for example, the old-fashioned contact tracing?
The most important reason is speed. So if you have to rely on manual forms of contact tracing, if you have to wait for a test result, if you have to delay by even a day, you've missed the opportunity to identify people before they transmit, and you'll lose control of the epidemic.
Bing Jones prefers the old-fashioned approach. He's a retired GP who leads the Sheffield volunteers. The Health Secretary has recently talked of restarting contact tracing and pledged 18,000 new recruits, but 15,000 of these will be centralised call handlers, a mistake according to Bing Jones, who says it has to be about local knowledge.
There are a lot of things which are not that sexy, and there are a lot of things which are hard to manage centrally. And there are a lot of things which depend on very, very large numbers of people. Shoe leather. Our little initiative here is very much it's a feasibility study.
And if their little initiative, as he describes it, is successful, local health officials are calling for it to be replicated across the country. Darshna Soni, Channel 4 News, Sheffield.
Earlier, I spoke to the mathematician Hannah Fry. She specialises in studying patterns of human behaviour. So I asked her first whether she thought this app would be useful in fighting the virus.
I think there's a lot of potential for systems like this, perhaps not as a silver bullet to fix everything in one go. Some research that we have just published indicates that even if 3/4 of people download this app, if we went back out of lockdown as we were before, the reproduction number would only be reduced to 1.4, and anything over 1, of course, is an epidemic. So I think that indicates not that this is something that we shouldn't try. I think it's really important that we do try stuff like this, but that even in the best case, you should think of this more as one tool in a suite of tools that will help us get back to some sense of normality, rather than the thing that's going to fix everything for us.
If we look at the figures in Singapore, where they did try this, 20% of the population, complied. How many do you imagine will actually really do this?
Well, that's the tricky thing. And I think that some of the design choices in this app are going to end up affecting that number as we go forward. So Singapore, like Britain, has opted for a centralised system. So essentially one where somewhere there is a spreadsheet of all of the handshakes that happen between phones. And if you have the master key, you can access it essentially. And that's the same as that has been done in Britain. But by making that choice, essentially it means that these apps won't run on the phone quite as seamlessly as perhaps some of the apps in other countries.
What role does the Bluetooth play?
So the idea behind Bluetooth was to just add that extra layer of privacy so that the app doesn't know where you are, has no idea where you are in the country, where you're visiting. It only knows when you are nearby to someone else. And the two phones, as they pass one another, if the app is running on both of them, will have essentially a digital handshake with one another, a code that's swapped from one phone to the other. So that later, if somebody is positive for the virus, self-reported, I should add, in this particular version of the app, they go in and report their symptoms on the app. If they're positive, then the sort of calculations that are going on behind the scenes will reverse, trace back the path that person travelled on, and alert anybody who was in close contact with the individual.
But that takes us to one other crucial thing which affects human behaviour, and that's privacy.
Of course, and this is one of the biggest arguments against the particular direction that the app designers have gone down, which is that because you have that spreadsheet, if you like, of all of the handshakes, if you have the master key, you can access that data, then that really raises privacy concerns. What happens to that data after the pandemic in particular? And I think that's really, I think that's something I would like to see change actually in the approach to this app. And I think that actually where technology has been used in the past for these epidemiological reasons to track the spread of diseases, really where it's worked well is when it's been time limited, where the people who are voluntarily signing up to the app know that there's no judgment really, I guess, on them using or not using the app, but also that their data is there solely for the purpose that is advertised on the box right at the beginning, and later on won't be used for something that they don't feel that comfortable with.
Hannah Fry, thank you very much indeed for talking to us.